is great advice, and we appreciate it. So, can you help our audience understand what biomarker testing is, how it helps identify specific mutations for the cancer, and and alterations that impact cancer growth?
Sure, this is a really great way to start the discussion about lung cancer because if we take a step back, um, it's it's really critical to understand that lung cancer is not one disease. It's not every lung cancer is the same. In fact, lung cancer is very much a heterogeneous illness that's comprised of many different subtypes, which all have distinct characteristics and distinct biology. And so the term biomarker testing, it's referring to testing a patient's specific lung cancer for either the presence or absence of alterations in different genes, or for level of expression of certain proteins that we know are important in understanding the cancer biology and also in helping determine the optimal treatment for the patient. And biomarker testing has become an essential part in the initial diagnosis of lung cancer and in treatment decision making.
All right. And one of the common questions we hear at Outcomes for Me is, how does biomarker testing or genomic testing differ from genetic testing?
It is indeed a very common question that we get asked as well in the lung cancer field. And that's because the two terms are often used interchangeably by patients and families and also by oncologists. But in fact, they're distinct terms, although they are related. Biomarker testing is more inclusive. It refers to not just gene testing on the cancer, but also other testing like looking at protein level expression. As an example, we perform testing looking at the level of a protein called PDL1. This is a really important protein in lung cancer diagnosis and management because it can tell us how likely it is that a patient's lung cancer will respond to a form of medication called immunotherapy. And PDL1 expression testing is not part of gene testing. Gene testing is looking for mutations or structure changes across cancer-related genes. So a truly interchangeable term for biomarker testing in lung cancer may be more molecular testing, quote unquote, rather than genetic testing. Another distinction that I want to point out is that sometimes people use the term genetic testing to refer more to testing for hereditary gene changes or mutations, meaning those changes in genes that are passed down from your parents to yourself or perhaps to your children or any kind of blood-related relatives. That is a very specific kind of blood genetic testing. More broadly, when we say genetic testing, it can be done to look for not just hereditary mutations using blood samples, but it can also be done to look for non-hereditary but cancer-specific mutations, and it can be done using either blood sample or using tumor sample that's taken through a needle biopsy, for example.